On today's episode of Hello Dreamer, we're peeling back the layers, pun intended, with Dr. Jonathan Zelken, Newport Beach's master of transformation and confidence. Whether he's sculpting with precision in the operating room or sharing his insight on the art of science and aesthetics, Dr. Zelken is all about helping people feel as good as they look. We'll dive into his journey, the real stories behind the glitz and glam of plastic surgery, and what it takes to build a thriving plastic surgery practice in one of the most competitive industries. Let's get started. What inspired you to be a plastic surgeon? Have you always wanted to be one?
No, I wanted to be an astronaut.
Did
How
you really?
I swear to God, all kids wanted to be astronauts. You know that? Like all little boys when in the 80s wanted to be an astronaut or like a policeman.
Okay.
And I was kind of smart, so I wanted to be a veterinarian or an astronaut.
Interesting.
Yeah. And so I was serious about it. Like not just like I want to like drawing pictures of like the moon and stars and saying I want to be an astronaut, but I loved like Carl Sagan and Cosmos and all that stuff. And it blew my mind from a young age. And it still does. Like I was just watching that Elon Musk stuff yesterday, the Starship
Yeah.
thing.
Mm-hmm.
It,
He
it,
landed
He
it for
loves Elon.
it blows my mind. It's just so, I don't know. It allows you to have a sort of an out of body experience when you think of the cosmos. Like we're so small in this universe, and like everything that we stress out about and cry about and lose sleep about is so inconsequential in the grand scheme of things. So that sort of philosophy drove me into wanting to be an astrophysicist.
Mm-hmm.
So when I was in high school, the one subject I was really good at was physics. Not chemistry, not biology. It was I was just good at it. I got it and I liked it. And so I got into Cornell, which was like
Oh,
where Carl Sagan was a professor. And I got an early decision for physics. And I got my advisor and all that stuff. But I also walked onto the rowing team. I was a walk-on athlete. And so I was like 75% athlete, 25% student when I was at college. And that doesn't mesh well with a degree in physics at Cornell. And so it was me and a bunch of just hardcore international students from Russia, China, and stuff like that. And I lasted a year and a half. And then my sophomore year at Cornell, I did something called like classical geometries. And I was good at geometry in high school. So I was like, oh, this is going to be easy. And then it was like we were learning things called like ideals and rings, and I had to prove that 1+1 = 0. And I was like, this was beyond what I wanted to do. At some point, I just was like, fuck this. Am I
Mm-hmm.
allowed to swear in your podcast?
Yeah.
Okay. So that was my sentiment exactly. And I still did pretty well. I got B+s, A's, and stuff like that at Cornell, which is pretty impressive early on. But I realized that I really fit in with the loudmouth like Long Islanders who are
Mm-hmm.
biology majors
Love that vibe.
more than the physics majors. And so I decided I'd be a pre-med, and I took a pre-med path thereafter. I never did research. I never like proved that I wanted to be a doctor or anything like that. And so that was problematic for me. I ended up doing well on my MCAT, which is like the test to get into med school, and I ended up getting like a 3.5 or something GPA, which is, I guess back then it was good. Now
Did
it's
you
like,
still want to be an astronaut at this time?
no, I gave it up.
Okay.
I couldn't prove that 1+1
Did
equals
you
0.
know you wanted to be a plastic surgeon at this time?
No, not at all.
Okay, but you're
I
like,
wanted to
I'm
be a
gonna.
doctor, like maybe like a pediatrician or something.
Okay.
Like, a doctor. I don't
Okay.
know. I didn't know what that meant.
Yep.
That was a problem.
Mm-hmm.
And med schools knew it. So I interviewed at a few med schools my first time around, and I didn't get anywhere.
Mm-hmm.
Because like my one letter of recommendation was from Coach Todd Kennett, who said, "Oh,
Your
Jonathan
rowing coach?
Zelken, yeah." He's I didn't have any lab research or anything like that, and he was like, "This is a super competitive kid and ultra competitive." I don't remember what his words were,
It
but
doesn't sound like a letter of recommendation to me.
it did not mesh well with medical schools, and so I had to do a year of research. I didn't have to do a year of research. I didn't get into med school, so I was like in this sort of purgatory. Like, now what do I do? I was at the top of my game at Cornell and stuff like that. I'm applying to med schools. This is spring semester of my senior year of college, and I was a varsity athlete. We were second in the nation for lightweight rowing, and I went skiing in Vermont with 3 of my friends from college. And my coach was always against skiing. He's like, "You guys, if you guys ski, it's on you. Like, you don't get hurt. Do
Yeah.
not get hurt." And it was 2002. Johnny Mosley Olympics,
Yeah.
and I was just so inspired. And I'm like, if I'm not going to be a rower, I'm going to be a freestyle skier. And so show off Johnny over here takes his skis down a half pipe, does a 360 at the end, dislocates my hip,
Oh my god.
his hip.
fuck.
I'm going between third and first
I
place.
Yes, exactly.
hear that.
I fell on my broken hip. shattered it. And then all of a sudden, I don't have a functioning hip anymore. I ended up having to go down to New York City from Cornell, and I had 12 hours of surgery on my left hip. And all of a sudden, I can't row anymore. So I'm in this purgatory holding pattern from med school. I went from being the fastest rower on my team to a cripple essentially, and I don't know where I am at this point. I'm kind of lost.
Mm-hmm.
It was a really, really hard time in my life. And then when I came back to Cornell after having surgery, I was taking a midterm in biochemistry. And I remember I thought I had a heart attack. I couldn't breathe. I collapsed. Paramedics took me down to the hospital, and I had something called a pulmonary embolism, a blood clot in my lung that almost killed me. 40% mortality risk. And I was in the ICU for about 7 or 8 days in Cayuga
How'd
Medical
you get
Center.
that?
Yeah, how'd you get that?
So if you're an athletic person and you're used to running and doing long distance stuff, and all of a sudden you're on bed rest,
Uh-huh.
your blood's not used to pooling and sitting still. It's used to pumping. It's used to doing things.
Yeah.
Furthermore, if you have 12 hours of surgery and you have like this basically post in your
Yeah.
groin that's
Mhm.
pushing on a vein, you get clot formation.
Yeah.
It's like the pipes get lodged up with blood clots. And when I started ambulating again, I think one of those broke free and went from a huge vein in my groin into my lung, and it blocked 1/3 of my right lung. So now it's just basically a water sack
Wild.
Wow.
on the right side. So I'm like 4/5 human now. And then, and so I didn't get into med school. The last medical school to reject me was New York Medical College. I remember I was on my deathbed at Cayuga Medical Center ICU, and I got that notification that I was not going to be taken off the wait list at New York Medical College. And I actually kind of went into pretty nasty depression for a while. And fortunately, the surgeon that operated on me took me in as a research assistant, like associate.
Mm-hmm.
And I was dead set on becoming an orthopedic surgeon,
Dang.
just like him. And so
Mm-hmm.
then now I have a plan. So I went from being like a generic pre-med, just going through the pathway, to being like, I'm going to be a badass orthopedic surgeon.
Mm-hmm.
Hips and knees. This is
Yeah.
what it's all about. So then I get into med school the next time because I have a good story now and I have research experience, and it was easy the second time to get in.
Mm-hmm.
And then during medical school, I decided that this is going to be my chance to shine. I had a chip on my shoulder, right?
Yeah.
Because everybody else kind of got in. I didn't get into med school my first time. And
Mm-hmm.
it was kind of easy to shine for me at med school. So,
I mean, it sounds like you want to be the best in everything that you do.
well, I did, but it came with a lot of expenses. And it was in medical school that I was just gearing up to be a badass orthopedic surgeon. Took a year of research off to do another year of research with this guy in New York City. Wrote a few papers, and then I applied for residency.
Mm-hmm.
But at that point, I started doing rotations in plastic surgery, and I was like,
Why would you do rotations there when
because I
you're
wanted to learn how to sew.
okay? So like the sutures in plastic surgery are like more
They let you sew in plastic surgery. Ortho,
Okay.
you're just kind of wearing a spacesuit and standing back. And I just wanted to like try it out, you know? Plastic surgery was kind of cool around 2000, the mid 2000s. That Nip Tuck show was on. It
Yeah.
was really glamorous, you know?
yeah.
Economy was pretty good before it crashed.
Yeah.
Uh-huh.
And it painted a really pretty picture for it. And as soon as I started doing plastic surgery, I was like, oh my God, this is
This is
so much better
This
than
is it.
orthopedic surgery.
That's
and then the rest is
amazing.
history. The rest
Yeah.
is history. I got into Johns Hopkins for plastic surgery, which is the most competitive hospital in the country at the time. I don't know if it still is. Because the chairman at Hopkins' son is an orthopedic surgeon. He saw my orthopedic surgery research. I reminded him of his son. I'm from Connecticut, where he has a house. And it was just a match made in heaven. And then the rest is history. That's how I
So
became a plastic
cool.
surgeon. Yeah.
Okay, well,
That's
I'm very excited for this conversation because I love plastic surgery. Like I love that you can like tweak things and make yourself look better. And obviously you've done my buccal fat removal and my chin lipo, which I love. And it was something that I was insecure about. So I want to hear more about like what is your style of plastic surgery? Because I know it's more like on the natural side.
It is more on the natural side. My style of plastic surgery is one of working really hard for a conservative, natural result. I think the best plastic surgery is the kind that people don't notice. If you look at somebody and they just look better and you don't know what it is, I think either they've done something with their lifestyle or behavior,
Yeah.
or they've had really good plastic
Yeah.
surgery.
Or
You know?
Can
combination
you
of both.
spot it?
It's hard sometimes when I can't. It's hard to spot good plastic surgery. I can definitely spot questionable.
It is
That's-
hard
surgery.
to spot good plastic surgery.
Yeah.
Yeah. Like when I see people on TV, celebrities, people on social media, sometimes I'm like, there's something there, but like you can't quite figure it out, you know, whether they take care of themselves or they had plastic surgery.
Well,
It's
people
just- yeah,
speculate, you know?
Exactly.
that means it's good plastic surgery or no plastic surgery.
Yep.
What are like the hottest trends right now? Like when people come into your office, because like we're in the Mecca, we're in Newport Beach, California. Like, and I know a lot of people don't like to know that they get plastic surgery. What are most of the things that you see, I guess, women in their 30s, 40s getting done?
That's a really great question. I mean, I think every plastic surgeon sort of, well, I think plastic surgeons who are known for
Like
certain
their own
things
style.
sort of attract patients
Yeah.
who want what they offer. So
Mm-hmm.
my view on your answer is going to be a little bit biased. I would say early intervention facelifts, meaning younger women who don't look like they need a facelift,
Mm-hmm.
you act on it soon. And that way they never get those folds that you can't really work out. You can't really iron out after a while. You
Yeah.
sort of prevent it in the works. And I think there are celebrities who sort of caught on to this early. People like, Nicole Kidman and others. By the way, I can tell she had a facelift. So that's probably a sign that it's not the best facelift in the world. But the point I'm trying to make is sometimes you can tell. If you do it right, people should not know you've had a facelift. And if you get it early, people who are savvy can look around your ears and spot the scars. Your hairstylist certainly will be able to, but it should be concealable and explainable. I mean, if you have a weird scar on your face, you can't explain that. But if you have standard aesthetic surgery scars, it's,
Yeah.
and they're
So like the
well done.
sutures
It's
are
not a bad
everything,
thing. It's not sutures. It's not
or
just
the way that it's
sutures.
sewed.
It's about where you put the scars. It's about offloading tension, and then finally, yeah, craftsmanship is really important. I think you got to find somebody who's not so busy that they have a PA or staff, not otherwise specified, sewing you shut on one
Like you
side.
do everything from A to Z.
Every stitch from A to Z,
Yeah.
especially on facial surgery. Now, when we're doing a full like body contouring procedure,
Yeah.
and we've got meters of scars down the arms and stuff like that, yeah, of course I'll enlist help.
Yep.
But everything on the face, without exception, is by me.
So
Yep.
what is the most requested procedure in Newport Beach?
The most requested procedure in my practice is facelift
Facelift.
surgery, specifically a composite T-plane facelift. But if you go to somebody who does only like eyelid surgery, maybe they would tell you eyes. If you go to somebody who does only body contouring surgery, maybe they would tell you a breast aug and a mommy makeover.
Yeah.
So like I said, it's
Do you
really
do that
hard.
also?
Of course.
But
course.
face is your focus.
I'm about 60 to 70% facial plastic surgery at this point. It's definitely my marketing focus. It's definitely what I love to do. But there's no reason that if somebody's coming into me and saying, "Hey, while you're there, I want breast implants too."
Yeah.
I'll do a great job with that as well.
Yeah.
I mean, I feel like that's definitely a thing. It's been a thing for a while, right? Just
What's
the breast augmentation.
Breast augmentation's been super popular. I think it ebbs and flows in popularity. I think the social media has painted an uglier picture of it in the past 10 years because of the risk of breast implant illness.
Do you
and
believe in that?
It's a controversial question. I do believe that.
I feel like I don't believe in it. I don't know why. Because like, how
Let's-
can you be fine and then not fine all of a sudden? I feel like people like have the victim mentality and they want to blame it on something. I don't know.
I don't want to put my opinion, even though I kind of see where you're coming from. I don't want to put that on the air. But what I would say is I think some women have legitimate concerns that can be traced back to implants. Because, for example, they're heavy, or because your body's mounting a reaction to a foreign material. That can happen. And there are women that you take out the implants and they feel better. But these sort of non-specific symptoms of brain fog and arthritis and depression and things like that attributable to like heavy metals in the manufacturing process seems a little bit out of touch. It seems a little bit unrealistic to me.
Yeah.
And I think for as many women as I've seen benefit from implant removal with these symptoms, I've also seen as many women have no difference in their symptoms with the implants removed, and then they feel disfigured and incomplete. So I think scaring women into taking out implants, if you have this sort of brain fog and non-specific findings of depression and arthritis and lethargy, which is also a sign of aging, a million things causing it.
Yep.
Mold in your house, exercise,
Yeah.
red number 3, you name it.
I also feel like breast implants like aren't as big of a thing as they used to be, because like now people are fat grafting to their boobs, right?
I love fat grafting. I think it's a beautiful thing, but I think breast implants are still going to be king for a while, queen, if you will.
Yeah.
I think breast implants are a lot easier, more predictable. You can get more increase. It's easier to.
Well, you don't even know they're there. Like you're like after they're in, you're like I couldn't imagine not having fake boobs. I feel like you don't even know they're there.
It becomes part of you.
It does.
And there's so many women that I know that say they have them, and I'm like, I never would have known.
Yeah.
I would have guessed, because you're right. It can and should become part of who you are. Whereas fat grafting, same thing. But fat grafting is less predictable, it's more expensive, and it can impair like imaging studies like mammograms and things like that, because if fat doesn't take, it can create cysts, and cysts
Oh,
can
that makes
become,
sense.
they can feel
Like
like masses,
nodules in
and you
your,
can see it on a
yeah.
mammogram. And even though theoretically, philosophically, using your own tissue to reconstruct your breast, it sounds so wonderful. It's great for like butts and things like that if you really need large volumes.
Yeah.
But for the breast, I mean, you can get a cup size at best, and it's expensive, and it takes time, and it needs to be done right and thoughtfully. I've seen it destroy women's breasts.
Yeah.
If it's done quickly, if it's done thoughtlessly and judiciously, you can get these lakes of
You use
oil
such big
cysts.
words. You're so
You
smart.
went to Cornell.
I feel like since The Office,
Do you even
I'm
know
actually
what Cornell
embarrassed.
is?
Yeah, I've
My-
heard of
yeah.
Cornell.
You have
I
great
mean-
teeth, by the way.
Thank you. They're natural.
Really?
No.
Oh, I was gonna say. How about you?
I mean, not a lot. Yeah, my teeth are natural.
Yours are natural.
Yeah.
Yeah. Just the top ones. They got
Yeah.
knocked out when I was a kid, so I had crowns. You know, those like 80s and 90s crowns that would like turn yellow. And like every 3 or 4 years, I'd have to like get them recrowned and recrowned. I'm like, fuck it, I'm getting veneers. Like,
It's nice though.
8 or
I
10 years
always
ago.
wanted veneers, but I'm afraid of like that little Dracula teeth phase. You
Yeah.
know, like
You have
under
good
knowing.
teeth
yeah, you have
too,
good teeth.
though.
Yeah.
This one
Yeah.
got knocked out in
Yeah.
college
You have good
before I
teeth.
broke my hip. I got in a college fight.
Bad years for you right
I
there.
know. Oh God.
I
Don't
want
get
to
me
talk about
started.
myths of plastic surgery because, like, even I'm obviously very pro plastic surgery, but I look in and I do my research and, like, the early intervention facelift, like, I for sure will have that probably before I'm 40 years old. But once you get a facelift, can you get another one? Because
That's such a good question.
yeah, and like operating on your face multiple times, like, is there an issue with that? Because I know when it comes to liposuction, there could be an issue with that, right? Because you build up scar tissue every time you go in with lipo. Am I right there?
Yeah, it becomes harder and harder. It's not
Yeah.
like it's not like at one point.
Okay.
It's like, okay, put up the red flag. You've hit your 4 liposuction procedures. No more for you.
Okay.
But it does become harder. It's this idea of diminishing returns.
Because of scar tissue.
Because of scar tissue, because you've depleted the reservoir a little bit, because there's just not that much more fat to get. I think those would be the 2 biggest issues. Yeah.
Okay.
Interesting.
And then let's talk about the face. So what's the multiple surgeries on your face?
You weren't alone when you brought up that question. I think a lot of people would say, like, I read, I don't know who they say, I don't know who they are, you know, they
Social
say
media.
that
They.
whoever they are says that, like, you can only have 3 facelifts in a lifetime, you know, or something like that. Like, if you get one now,
Oh, that makes me feel
then you
better.
can't have one when you're 70, like, or something. It's something like that. I don't know, but a lot of people have fairly valid concerns that, like, you can only do a few in your life, or something like that. You've brought it up. A lot of people bring it up. I don't know where the source of this myth is, because there are just so many variables behind it. If you go to a good plastic surgeon, there's no reason you can't get 50 revisions in your lifetime and just heighten it another millimeter per year. There's no number. There's no dead limit, stop limit, you know? What I think this arises from is a generations old habit of doing skin only facelifts.
Is that SMAS?
No, skin only. Like back in the day, facelifts evolved from being a skin only procedure, and as the generations go on, we are lifting deeper and deeper.
So you're
And
literally just pulling the skin and cutting, stitching.
we are pulling the skin from underneath. We're not touching the skin for
Yes.
as much as we can.
Well, now you are, but you're saying back then it was
Back
skin
then,
only.
yeah, you pinch out some skin because you do this.
Yeah.
Doc, this looks so good. Can't you just do this, please?
Yeah.
It looks so good. Just do this. And it doesn't work. Skin is a weak structure.
Yeah.
You're pulling it back from way back here. Skin gives, and it might look good for a few weeks, a few months, and then you look exactly the same, but you have big wide scars to show for it.
Yeah.
So that's why the lunchtime lift. You know, these little sort of
Oh, the
lifestyle
weekend,
lift,
the
or
weekend neck lift. Yeah, that's like
the
a thing.
weekend lift.
Yeah.
That's why these things just
my
you
God.
gotta
I know
beat
about all of
somebody
them.
up. You've got to deconstruct a face from way down, and you've got to pull those deep structures tight, and then let the skin just drape over, tension free.
Yeah.
Don't rely on these sort of weak structures to hold your face up. Rely on the hardy things from down below, and that is the evolution of the facelift. So, to answer your question, there is no reason that you can't keep advancing that flap further and further if and when it ages. Now, this operation, this newest iteration has only been around it's been popular for 10 to 15 years. Really, it hasn't been much longer than that. And even with older generation like smazectomy and smaz plication, older generation facelifts, really hold up well. I remember I did one on a woman before the Ozempic craze, and she lost 40 pounds. And when I saw her again, I knew that she's going to need another facelift because even though it had only been 5 years,
And well, losing all that weight changes
and
your
this was
body.
with a mastectomy and plication,
Yeah.
which is like an older style facelift. That's how I learned 10 years ago.
SMAS and deep plane are two different things.
They're different things, but
Okay.
but SMAS is part of both facelifts. But I can get into that
Yeah.
if you want me to.
I mean, no one's going to know the difference except
But-
me. I want to know, but
Well, I want to talk about that too.
okay. Well, talk about whatever you want.
Okay,
Go.
I just want to wrap real quick.
Yeah, do it.
I think if you're pulling the skin tight,
Okay.
you look weird.
You do. When I do
Totally
it in the
weird.
mirror, I'm like, do I want a
You
facelift?
get your mouth widens. You get if you're old, you get these lines that kind of come up your neck a little bit. If you've had previous facelifts, you get this windswept appearance, and you keep tightening that, and you look weirder and weirder and weirder. But with the more modern generations of facelift, I don't think that's the case at all.
Okay.
I think you could continue to advance it if and when you need it. Now, if you get a facelift when you're 35, and when you're 50, you want to do another one. There's no reason when you're 65 you can't do another one. There's no there's no limit. There's no set stop point. There's no don't get a facelift till you're 65 because if you get one now, you can't get one when you're 60. Do you want to look at your prime when you're in your 40s and 50s, or do you want to look at your prime when you're in your 60s and 70s?
I mean, I want to look at my prime now.
Always.
Now.
Yeah.
When you're in your professional prime.
Well, now, and I'm going to maintain forever.
So I think that's the idea. That's what sort of switched me over because I'm an East Coast guy. You can sense it. You can smell it on me. You can probably. You said I use big words. In the East Coast,
You're an East Coast guy.
In the
My
East
dad
Coast, we
is
call those words.
the heart of New York born. Like my whole family's East Coasters.
Yeah,
which I love.
That's
Cut
why
to
you're a
the chase.
businesswoman. That's
I
why
love
you.
it.
That's why you get the bull by the horns. You know, but we call them words. You guys call them big words out here. Thank you. What was I saying?
See, that didn't even affect me because I mean it affects the SoCalers, but not the true New Yorkers that were born and raised. But keep going.
I don't even remember where I was going. I was working on that joke for a while, and I finally delivered it. I got some courtesy laughter. I appreciate that, guys. Yeah, the point I'm trying to make is there's no set limit for facelifts. You do one now, you can do
How
another
long does
one
a
in 15
facelift
years.
last?
Honestly, like it lasts until you are ready for a revision.
Yeah.
And that could be 5 years, that could be 20 years.
Okay.
I haven't had to revise any of my facelifts since I started my practice 9 years ago.
Okay.
I did one.
Even though
I
you
did one
switched
neck,
styles.
one neck touch up.
Okay.
Of all the ones I've ever done in the past 9 years.
Yeah.
How long would you say they typically last, though? Like
we learn 10 to 15 years.
10 to 15 years.
Yeah.
How do you feel like social media has affected
I was gonna
people's view on plastic surgery, facelifts, whatever? Obviously, there's trends that come and go. We were just talking about the breast thing.
I know everything facelift, plastic
Because of
surgery
social
because
media.
of social media.
So
What little
this
I
I
is-
know
found
because of
you, I
social
think,
media.
because of social media to do my chin lipo.
and I'm not even a social media guy. So I really appreciate that. I'm trying to be better at it. Part of who I am, the whole conservative kind of East Coaster, thoughtful surgeon things. I don't like to self-promote. I'm more of a magazine surgeon. I'm a little bit of an old soul when it comes to that. I'll do advertisements in magazines and stuff like that, print advertisements. But I just have a little bit of a not so secret disappointment with fellow plastic surgeons who dance on social media and don't act their age and don't maintain a sense of professionalism, because even though we're kind of the fun specialists of compared to like nephrologists and cardiologists, I apologize to the nephrologists and cardiologists who are listening to this podcast, but we're like the fun ones, we're like the cool guys, whatever you want to call us. The truth is we're still professionals, and we're still doing risky surgery on people, and we're still putting knives and dangerous instruments inside people's faces and putting their lives at risk. And so it's incumbent upon us to maintain some sense of professionalism. And I think it's disappointing to me that social media rewards this sort of lifestyle and behavior of being a goofball.
Like the TikTok dances?
Yeah.
You don't do those?
I don't do that.
Okay.
No. And I think in real
don't.
life, I'm like the biggest goofball of all. Like I really do feel like deep down inside, for people who know me, I am a goon. But like on social media, there's a role for, we're still doctors.
Yeah.
We're still operating on people's daughters. We're still operating on people's mothers and fathers and brothers. And to take it lightly and to say, this is just an act is not something that's appropriate. It's not professional. It's not ethical. And I take a lot of issue with
I've
it.
never even seen this happening, but I would never go to a doctor that I feel like did that.
There's a ton
What
of
are you talking
yeah.
about?
I've never seen
everywhere.
doctors plastic surgeons dancing on TikTok? I mean,
I so want to name drop right now, but I'm gonna hold it in.
okay, you can tell me after.
People can put it in
This
the
is
comments.
like a new thing
Put it
to
in
me.
the comments below. So I have a YouTube channel, and I do embrace that. You know, I think it's a platform to educate.
Yep.
It's a platform to show the craft. It's a platform to allow people from all over this country and the world to find me and be attracted to me for my skill set and my personality. A lot of people say, you know, you're the most thought, you know, a lot of people talk about this, but you're really, I can tell you put a lot of thought into it. I think that's an appropriate use of social media. But, you know, getting influencers on board and making a fool of yourself is, even though it's very rewarded nowadays.
Well, monetarily, right? That's really it.
That's how you get people.
Yeah.
I don't have 1 million followers. I have, I don't know,
Yeah.
couple, I don't know, a couple thousand, 30,000 or something like that on social.
Yeah.
You know, but it's, and if I started dancing, if I started like making jokes or having these sort of viral reels, maybe it would be higher. But I don't want that.
I like the before and afters though. I feel like those are impactful. Like I look for those when I've found plastic surgeons, it's because of those before and
I was
afters
going through
on
your page
social media.
last night, and that's before my my hair and stuff that she's had done. Like that's what sells people, I feel.
Yeah.
That's what sells sophisticated people like yourselves. It doesn't necessarily sell globally.
It's crazy. So like a monkey dancing, like some of these people, right? That's going to attract attention over the before and after, like what you're actually physically getting because you're cool and you're hip and you can do the TikTok dance. Isn't it wild?
It's wild because you're a grown up.
And
you're
get it.
sophisticated and you get it. And you're going to be rewarded for your decision making. You're going to find a good plastic surgeon that jives with you.
Totally.
Unfortunately, that's not what sells to everybody. Not what sells to the majority. And, you know, plastic surgeons all eventually cave in. I didn't have a TikTok account until this year because I signed on to a company called Carry. I'll give them a plug. And the marketing team there was like, you have to have a TikTok account. And that's kind of ironic because now we're going to lose it. But
I think
Are we?
No.
It's going to stay on?
Yeah. The can got kicked down the road.
Oh, the can got kicked. Is this just in?
Yeah. I don't know.
This just in. The can got kicked down the road.
Yeah, I don't think it's gonna happen.
I personally don't like TikTok, so I wouldn't mind if it
I
happened.
don't even have it on my phone.
Okay.
I wish social media didn't exist either. Like I hate it, but I'm a
know.
part of it and I do it. But
I know.
it's so toxic to me. Like I wish we lived in a world like that was not social media. But
can I put a plug in for a product?
Sure.
I don't know if we're gonna get in trouble for it. Me too.
Okay.
And I know you need social media. I was off it after COVID. There was a Netflix documentary called I don't remember, The Dilemma or something like that. I don't remember.
Oh yeah, we watched that.
And we're just capital. All we are is money to these companies, and they're just trading. They're just trading us back and forth, and we're just rooks. And so I got to a point after watching that documentary. It affected me. I'm not embarrassed to say that it affected me. And I was scared to be on it. And I just deleted all accounts. I closed my Facebook account. I closed my Instagram account. And for years after COVID, I was off of it. I didn't want to be victimized, a victim of this misinformation and be toxic and be just sort of, I don't know. I wanted to make my own decisions.
Yeah.
And mainstream media also bothered me. I became almost, I don't know, I'm not going to say paranoid or, reclusive, but I really just wanted to stay away from that and find sources of information that were more organic.
Yeah.
Then I realized that not having social media was really dangerous.
Detrimental, yeah.
It's very detrimental for any business owner. You got to be available. You got to be present, and being on social media is part of it.
Well, everyone's there, so you have to be there.
So that's
where people gather.
Yeah,
it's obtain their information.
It's where people gather.
Yes.
Yeah,
it's a gathering place. Live, love, laugh, gather. On social media.
Have you ever been in the midst? I was thinking about this last night. Like to me, like seeing somebody's face cut open and like blood skull showing, like has it ever have you ever been taken aback in the middle of surgery and been like, oh fuck, I'm operating on this open face? Or does it just not even phase you? I don't swear,
so I didn't say, I would never say oh fuck.
Does it not does it phase you ever where you're like, damn, what did I just open?
So the plug I was gonna make was for an app called Screen Zen.
Okay.
So if you don't want to be victimized or exposed to this toxic environment that just brings you down, there's a free app called Screen Zen, and I'm so embarrassed that I'm saying this. I feel like I'm an owner of this company, but it's free. And you put it on your phone and you choose the apps that are affecting you. And then rather than having this knee-jerk reaction where you pick up your phone out of your pocket when you're bored and your thumb goes to that red and pink icon, just by literally a
You're
pattern
trained. You're
pathway,
like,
a
It's
dopamine
like habitual.
Yes.
Pavlovian dog.
Yes.
Now
Yes.
it's grayed out, and when you touch it, you can set the timer, and you can wait 20 seconds before you open it and ask, "Do you really want to open this?"
Yeah.
So it's a
Oh,
little bit of a pain in the
interesting.
ass, but I've had it for like a few months, and it's taken my Instagram time down from like maybe an hour and a half a day to literally 5 minutes a day.
Yep.
I'm still on Instagram. I can still see,
Yeah.
you know,
Get your
engagement and things like that.
messages.
Get my messages, but now I can be more present for my children. I'm not going to be like depressed that I'm not keeping up with the Joneses. I'm not going to be angry because somebody put up such a
I
bullshit
love it.
before and after.
Yeah.
Screen's end.
I
To
love
answer
it.
your question,
Yeah, I want to hear this one.
you know, no,
No?
no.
Is it just because you've done so many? Let's rephrase it. What about it first? Like when you went into it, no.
No, and I have a twin brother who couldn't even watch those Discovery channels about the shows about plastic surgery in the early 2000s. They used to have a ton of plastic surgery like channels or shows. Plastic surgery before and after with Jan
Yeah.
Adams and all these
Yeah.
other things. The Swan Extreme Makeover. I love that stuff. My twin brother, my own kin, was like, I can't even watch this. Turn this shit off.
What does he do?
He is retired.
Oh, my dad's a twin
Nice.
too. That's cool being a twin.
Yeah, fraternal, but still.
Yeah.
No, it doesn't phase me. I still have a tremendous respect for what I'm doing when I'm looking at people's facial nerves. And I operate on a lot of friends and family. When I'm looking at people's facial nerves and things like that and these deep vital structures, it does have an impact on me more like, holy shit, this is the nerve that triggers the smile that I see every day. And I'm looking at it. And if I fuck it
That's
up,
cool.
then I won't see that smile every day. And don't get me wrong, that thought will go through my mind on every operation I do, friend or not.
Well,
You
because
know,
that's the risk of nerve damage, right?
everything I
Yeah.
do,
Yeah.
a visible scar. Every stitch I place is
Yeah.
going to lead to a scar that I could potentially see
Yeah.
on somebody I see a lot every single day. And it's not just friends and family. It's everybody I operate on that sort of thought process occurs. But it's not one of being grossed out or phased otherwise. It doesn't
Mhm.
gross me out. I think anatomy is a beautiful thing.
Yeah.
I think once you do a beautiful dissection, it's really it's inspiring.
Yeah.
And it brings you back to this sort of divine, like, I'm not a very religious person, but
Mhm.
there is something really special about the human form.
Human body.
Yeah.
There is something really special about
I
it.
Have
agree
you
with that.
ever opened anyone up and been like, I got like, what do I do here? Like it wasn't what you were expecting, I guess.
If the answer was yes, there's no way I would admit to it. Sure, I'm sure. Yeah,
Yeah.
sure.
And you just
More-
because you know what you're doing so well because you're an
No,
expert, you
no.
just figure it out, or
Straight
like
talk. No, and more so in reconstruction.
okay,
When you're doing traumatic reconstruction and things like that, and things don't piece together right, or something's missing, it's really hard to try and get a result when the anatomy is not normal.
yeah,
No, I have a question for you. The anatomy not being normal, you probably have to go in and redo people's work, right?
Yes.
What does that look like when you open somebody back up when it's been fucked up?
This
This is like the mecca for like we started out with this. You can tell on that person, you can't tell on that person. There's so many women, especially in like their 60s and 70s
especially
right now,
here in
here
Newport
in Newport
Beach.
Beach, that have had facelifts when it started becoming a thing, and you're like, oh my god.
Yeah,
Holy
my
fuck.
personal evolution, especially being trained in reconstructive microsurgery, formerly trained in reconstructive microsurgery, was that, and I did a lot of trauma reconstructions at Orange County Global when I started, was that I was kind of becoming a revisionary facelift surgeon. Like I did as many revisions as I did primary
Interesting.
facelifts. And I thought I'd be a hero every time. You know, you see something and you're like, I can fix that. Right? That's the young arrogance. I can fix that. Yeah, I lift it up and it goes away. I could fix that. And so I would take on a lot of challenging cases, especially around the mouth, and people still had wrinkles and folds around the sides of the mouth. I can fix this. And then you realize after years and years of thinking you're a hero and you're going to fix it, that it's actually a lot more humbling and harder to fix revisions than you would think.
But can you fix them?
Yes, you can make them better.
Who's that
Oftentimes make them better.
one? Donna Valentini or whatever. She's the designer girl
Oh,
who has
Versace.
Yeah, yeah.
I've just seen
Her
a few.
she just got a revision. I mean, she still looks like shit because hers was fucking terrible, but it looks better than it did.
You know what? I'm going to jump in on this one right now and say all of this, including Lindsay Lohan, all of
I
these
love
people,
the way that she looks, and I think that she
I
had
know,
a facelift.
I know. That's where you and I we're gonna spar on this one a little bit here. But I'm telling you that a lot of this fucked up look that you're referring to is
Mhm.
actually more related to the injudicious use of fillers and the unartistic placement of fillers.
Mm-hmm.
And just either letting them dissolve and putting them back in the right place, or gaining weight, or doing something to harmonize the face.
Yeah.
And to remind somebody that fillers aren't the end all be all answer because they're safe and reversible.
I'm
They're
against
not.
fillers now.
Don't be against them, but they have
I
a
don't like
place.
them. I'd rather just be cut open and sucked and pulled
Well,
than filled with filler.
I'm not going to sit here and tell you that fillers are evil because they're not. I believe in
That's
fillers.
one of my questions, actually. Are there any non-surgical treatments you think that are like underrated?
Underrated non-surgical treatments. That's a great question. Nobody's ever asked me that one before. I think lip fillers are still the best for lips.
Botox.
Over fat transfer to your lips? Do you
Over
do?
fat transfer.
Okay,
I do
you'd
fat
rather
transfer.
do-
I do it every time I'm doing a facelift. If somebody wants fat transfer lips, I'll do it. The problem is when you're taking fat out of a human body and you're replanting it,
Yeah.
you're literally taking cells, you're unplugging them, right? There's no more oxygen to these cells. They're outside the world. Like, how are they going to live?
Yeah.
Like little machines, little engines. You think you're just going to put them back in and they're going to live again? No, they need fuel.
Well,
They
doesn't the
need
body
diesel. They need diesel.
fuel them?
Only if the cell is touching another cell that has an oxygen supply.
Interesting.
And
Got
oxygen
it.
can cross the cell wall and keep the other one alive.
So like they're little scuba divers who like need the
I
mask.
can't breathe. You know, you got to put it back. Each scuba diver's got to touch a tank somewhere. If you touch the tank,
Makes
you're going to
sense, makes
live.
sense. Okay.
Right? So,
That was a good analogy, right?
so the problem with the mouth, you're talking, you're laughing, and there's just constant shear.
uh-huh.
So in my opinion, that the fat grafting take in the lips it's not as reliable as the cheeks or the butt or the breasts, where the tissue is a little bit more immobilized.
Got it.
Interesting.
So yes, I like doing it. I'm happy to do it. I do have patients who will tell you that the fat that I place in their lips survived and it's great and they haven't needed fillers, but I never promise long-term results with lip fat grafting.
Yeah.
I still think fillers are great for the lips.
Botox too.
Oh, Botox is underrated. Botox is awesome.
Underrated. Interesting.
You know what I'm noticing though? Because people are doing it all the time now. Nobody talks about this. A lot of people are getting big veins around their lower eyelids, like right here and
Oh,
right
I haven't
here.
seen that. Oh, you've told me this. You think it's
Yeah.
because of
Attributed to Botox?
Yeah, because Botox is a muscle relaxing
Relaxer, yeah.
agent. It's a paralytic.
Yeah.
And that includes the blood vessels. So,
Interesting.
for example, if you have a disease where the blood vessels, like Raynaud's or Berger's disease is
Yeah.
the name of something where literally if you're a smoker, your fingertips fall off because of blood vessel constriction. The
I've
cure
never
is
heard of that in my life.
Berger's disease. You learned something today in your podcast.
I mean,
and
I've
I hope
learned
all of your listeners
I've
learned
learned a
something.
lot.
Yeah.
But you inject Botox in the web spaces and it relaxes the arteries, and so it can help you,
Interesting.
right? But it also relaxes veins. And what I'm seeing is a lot of people get Botox around the eyes and the crow's area, and it's causing the veins to dilate.
Mhm.
And so even when I'm doing facelifts, I can tell when people get a lot of Botox because the veins around the eyes are becoming huge.
Visible.
Yeah.
Like more
Yeah.
visible or,
Yeah, like,
or
look at-
huge. Under,
Like
yeah.
this guy is going to get big on you. Keep doing Botox.
It's been there my whole life. Nothing I can do about it.
It's a handsome vein. It's a sign of
I'm a
wisdom,
vascular dude. I don't know what to say.
right?
Yeah.
You're an athlete.
I'm an athlete.
That's what matters.
Yep.
And so, but I do think that I am seeing some signs of long-term use of Botox that are not really discussed. But I also think that Botox is worth it. I don't do Botox because I'm the biggest weenie in the world. I have endless access to
Have you had anything done?
Botox, buccal fat pad removal.
Okay.
Interesting.
You just said you hate Botox, but you've had it done.
You do it.
I
in your
get it all
office.
the time because, well, I don't get it all the time. I get it once a year because my wife tells me I have to.
How do you
And
approach?
she can't stand the washboard abs in my forehead.
How
do
do
it in your
you?
office, right?
Yeah, we do it in my
Yeah.
office.
Yeah.
Sure.
Nice.
How do you approach people who come in with unrealistic expectations?
Can I just answer the most
Go.
underrated?
Do you want to
procedure,
ask the questions?
non-surgical?
Oh,
No, I
go.
want to answer the question.
Okay,
yes,
go.
that
Ask
you
it.
asked me.
Ask it.
I think CO2 laser resurfacing of the face is the most underrated
I want to do
procedure.
that. Let's both do that. We'll do it the
Because
same
it's
way.
We'll be
it's the
sunburned
OG.
together.
Yeah.
It's the OG. And the whole industry is like, there's an unmet need for less downtime, faster results,
Yeah.
less pain, blah, blah, blah. But the truth is, yeah, I could slap your face and make it red. And you can feel like, oh God, look at I'm glowing for a few weeks, but it's not really doing anything. I got to create an injury to get a meaningful result. And that's where CO2 laser
Well,
comes
because
in.
that hits the deepest layer, right?
It's not that it hits the deepest layer. It causes the most controlled but meaningful
Yeah, but
disruption.
so break that
Got
down.
it.
Like give me like the 2-minute synopsis of the laser. Sell me.
It breaks it
You're
down
a
and
child
heals
of the
it.
80s.
What?
You're a child of the 80s.
Yes.
Remember dot matrix printers?
Yes.
Like, brr, brr.
Yeah.
So that's kind of how our CO2 laser works,
With
right?
the holes on the side.
Yeah, that's kind of how our
Paper.
CO2 laser works. Is rather than frying your skin, it is setting us just a series of pulsed laser beams into your deep dermis and your superficial layer of your dermis. 2 separate passes per square. You hold it and it goes brrr, and then brrr in a superficial pass. And what you're doing is you're getting a full thickness destruction, controlled destruction of a fraction of every patch of skin on your face. And so you leave some of it intact. So you don't get that glossy porcelain skin that we'd seen in the 80s and 70s, but it's still destructive enough that you'll weep, it'll look nasty, it'll be uncomfortable for a week or two. But doing that really gives you a certain glow that I can recognize because people's skin looks really good. When you see people whose facial skin looks great, but their neck's starting to show signs, they probably had some sort of Fraxel or CO2 laser at some point.
You
Can
can do
that
the
be done?
neck
Can
too,
you be done
though,
on the
You can
right?
do the neck, you can do the chest, you can do your
Okay,
hands.
so
It's just-
we'll do before and afters. We're gonna use this little clip and we'll do the whole process. Let's film it of both of us getting our CO2 lasers.
Sold.
Okay.
Okay.
Yeah.
That's the most underrated. Now
Okay,
keep going.
I'll
I don't
get
want
it.
I don't want to ask the
So
question.
You could fucking talk me into getting anything.
Is it good?
Like, I'm down.
Yeah. So it's good for wrinkles?
And acne scars, right?
It's not great for wrinkles. It's great for there's static and there's dynamic wrinkles. Okay. Static wrinkles are the ones when you're at rest and you see them.
Got it.
Dynamic are the ones you can create. If you get the static ones, it's too late. You haven't been doing your Botox enough.
Yeah.
And so when you're at rest, you see these fine lines going across your forehead. That's the wrinkles that the CO2 is going to target.
Got it.
You still need to do Botox though.
Got it.
One.
All right,
not
I have a
you. I'm
couple-
not talking
I have
to
a-
you. One still needs to consider.
I'm a grown man, I can handle it.
And I'm saying Botox, I mean any form of neurotoxin. I'm not going to use a trademarked term. on your
Yeah.
podcast. I don't want to get you in trouble. don't
Yeah,
wanna
I
expose
use
you.
the Exium or whatever. You're like, wow, you should probably start doing that. I
know
don't
what that
know.
one is.
But it's like Botox. It's the
Okay.
same thing. It's like
Javo?
no. I'll tell you after.
How do you feel like you're-
Evolus?
No. It's like Exium.
Daxify?
I've used Doxify before because that's supposed to last
Is
longer.
there
but
one
it
that I
did
don't
not.
know
What
of?
is
Am I
that?
that out of
What
touch
is that,
then?
like Botox?
Yeah, well, they say it's supposed to last longer. I personally did not
No,
notice the
it didn't do
difference.
anything for
But
me either.
what's
Yeah.
tried, true, tested is still Botox, right?
For me, yeah. I'm a huge fan of the OG in a lot of cases. They've been around the longest. They've done the most testing. They've had the most experience. There's the most science behind it. These new disruptors that are coming into the market are designed to answer some of the deficiencies in the current products. But there's not long-term testing on these products, and they're coming out every year or so, and it's just too much to
That's
juggle.
scary, yeah.
Yeah.
So
Is there long-term testing
think,
for Botox though?
Oh yeah.
Okay.
Oh yeah.
Yeah.
You're talking migraines. You're talking. I mean,
Sweating.
forehead, sweating. It does everything.
Yeah.
Yeah.
Okay, let's a couple more questions. The unrealistic expectations. So when somebody comes to you with unrealistic expectations or they've just had everything done and they want more, like how do you handle that? And do a lot of people come to you with plastic surgeon addiction?
I wouldn't say a lot of people do, but I can sense. I can sense when people do have that. There's nothing really wrong with it. I think it's what that stems from is a desire that we all have to control what's hard to control everything that we can't control. It's almost a religion, right? Like we go to church, we go to temple to try and get a better sense of things that we can't control. We can't control the fires in Altadena, we can't control the fires in the Palisades. And so how can we grapple with this? What can we do? We can go to church, we could pray to a higher power. I think plastic surgery, believe it or not, answers that calling for a lot of people. I think there are people who feel that having facial features is getting in the way of their life. And that is there's a name for it. It's a psychiatric condition called body dysmorphia.
I have body dysmorphia.
No, you don't.
I do. I
Okay.
seriously do.
All right, noted. I'll put it in your chart.
Okay, well, actually, I take that back.
So 7 to 11% of our patients, according to the literature, have body dysmorphic disorder. And it really deserves psychiatric intervention.
Mine's not that extreme.
Usually it means that something that, yes, it can be identifiable. If somebody has a little break in their nose or something, it's usually when somebody takes that out of proportion and truly internally believes that is why they can't maintain a relationship. That's why they can't get a job. That's why they can't succeed professionally. When you have a sort of discrepancy between visual things and how you perceive them to impact your life, that's when you get body dysmorphia. That's at some point it's incumbent upon your plastic surgeon to warn you that plastic surgery is unlikely to fix this.
Yeah.
And so some of the addiction that I see, and I don't see much, but it's not really an addiction. It's people who sort of fall into that category, and I'm not shy about it. You know,
Mhm.
it's an insulting term. It's a triggering term to say that to somebody,
Mhm.
and I think that people's response to it is usually one of defensiveness and defiance, and
Well, it's kind of like, you know,
it's
like any
it's
addiction,
like
people
fuck
get.
you. Don't tell me I'm body
Yeah.
dysmorphic. I hate this. Fix it.
Yeah.
You
Yeah.
know, and that's reasonable, but it goes along with the thing that sometimes people want control. Everybody wants
Mhm.
control over what they can't control,
Yeah.
and plastic surgeons just have to be forthcoming,
Mhm.
even if it means using an insulting term, and say, I recognize that this is what you want, but my duty as your plastic surgeon is to tell you I don't know if I can achieve this.
Yeah. That makes sense.
And if I'm going to use a big word, if you're unscrupulous, if you are more greedy, if you will,
It's a
What
word.
does that
and you
even
want
mean?
to, if you're just more focused on numbers and getting patients in the door, then
Okay.
you are being a thoughtful provider and
Mhm.
giving patients what's best for them, then it's easy to target and prey on these patients
Yeah.
because they're a source of revenue over and
Do you
over
feel
and
like a
over
lot of
again.
plastic surgeons do that
I do. I do. I think especially the people who are more like, we talk about the sort of the TikTok,
out there?
the
Dude, just preying on
TikTok
people's
Yeah.
famous
emotions.
people,
Like you guys,
not
you
preying on people's
guys are like,
emotions, but taking advantage of the fact that these people will continue to purchase services to try
Yeah.
and achieve a goal, rather than providing education that that goal may not be achieved with plastic
that's
surgery.
kind of where I was going with that, though. Those are emotional decisions that somebody makes, right? If they have a condition, body dysmorphia, if they want more, they feel like they need more. If they have the means to do it, they're going to want to fucking do it. They're going to seek someone that's going to do it for them.
If you're not going to do it, somebody else will. And
Exactly.
that's how I rationalize to myself
That-
and a lot of patients. Like, if I'm not going to do it, somebody else is going to do it, and they're going to prey on this person and hurt them.
Yes.
My job is to step in there and do little things if I have to keep them
Or talk
chugging
them out of
along.
it, right?
Yeah.
Ideally, talk them out of it. The challenge with this procedure is that a plastic surgeon is not necessarily the best resource to treat this condition. And
Yeah.
so when you refer to psychiatric specialists, you can imagine what
Yeah.
an insult that is to somebody.
Yeah.
And
Yeah.
it stigmatizes them.
Yeah.
And they go from trusting you to help them to being crazy.
Totally. I feel like there's like a code of ethics that everyone should carry, just morally, right? But especially being a doctor, a surgeon, like you guys almost like have the power of God in your hands. That's got to be a cool feeling, but at the same time, like a very humbling feeling where you have to be ethical.
You have to wield that power carefully. And you're
Yeah.
exactly right. And so that's why I likened plastic surgery addiction to religion.
Mhm.
And it's a controversial statement, and I'm sure there's going to be somebody who reads into it the wrong way, and I don't
No.
mean it in the wrong way.
Yeah.
But the truth is, we do play the role of God in a lot of cases,
Absolutely.
and especially with my new direction in my practice of customized facial implants, where people feel that their facial structure is stopping them from getting where they want, and then they cite literature that says, well, according to this article, people with this feature and a defined jawline get farther in life. So my custom facial implant practice really does appeal to that group. And there is
Mhm.
some truth in it because it's scientifically backed. It's not that they're crazy. Yeah, I have a really weak jawline. It's not masculine. I can't get a girl. Maybe if you define this, I'll have a better chance. Right.
Mhm.
And so
I
that
like
role
a
of
sharp
God,
jawline.
you have a sharp jaw. According to AI, I need jaw implants.
According to AI.
Isn't that
AI?
crazy?
Wait,
Fuck.
is there
Isn't
something?
that crazy?
Do you have AI that can scan your face?
Oh,
Why didn't you
There-
tell me this?
God, let's
There's,
get.
there's so much
Are we
available.
gonna unpack? Are we gonna unpack?
I
this
want my
today?
face scanned, and I want to know
Are
what
we
they
really
have
gonna,
to
Are
say.
we really gonna unpack
that
this
goes
today?
that kind of goes hand in hand with something I was gonna ask, but yeah.
Chris, you've got one of the better jawlines I've seen.
Yeah,
Really?
he has a good jawline. He has a good
That's
Got
jawline.
one of
Natural
the
too.
better.
Yeah.
Mary and Peter, thank you.
Thank you, Mary and Peter.
Yes.
No, he has a good jawline.
appreciate
Our
that.
kids
Thank
are gonna
you.
have
You said you wanted a compliment. I'm
very
giving you-
defiant jawlines.
Both of our kids have like high cheekbones. Like she has a defined
I have,
jawbone and
I
high
have two
cheekbones.
defined. We've already talked about
We're
this.
gonna have two little model girls, and I'm not just saying that because I'm their dad. Like they're very good looking human beings.
I really want to see a picture of them.
They're
I have it
cute.
right here.
They're cute.
Those are two adorable little children.
Yeah.
Yeah.
What are their names? Oh, I need to tell me.
Poppy and Rocky.
Poppy and Rocky. Yep.
They're sweet.
Yeah, they're
That's pretty
sweet.
good.
If you someone getting plastic surgery for the first time, I guess what advice would you give them to wrap this one of my favorite interviews yet?
Yeah, it's
up?
good. I actually have a question too.
Okay.
What would I give anybody considering plastic surgery? regardless of how fun and minimizing we are of the complications and risks from time to time, saying, "Oh, you'll love it. You're going to look great." Just remember, plastic surgery, even though in the vast majority of cases, this is why it's a successful specialty, does help people and achieve its goals. There is definitely a subset of patients, fortunately, a very small minority, who do look worse and spend
Mhm.
all this money to look worse, and that is a possibility. You can injure nerves. You can have ugly scars. You can fail to achieve the cosmetic goals. You can overcorrect. There's so many things that you can do to make somebody worse. First thing you ask me, Chris, is do my eyes. And I'm looking at you, knowing what eyelid surgery can do, and telling you, you look better now with a little bit of a skin fold above your eyes as a male with good facial structure, in my opinion, than
Mhm.
you would with a well-healed scar and correction of that. A
I
slight
just meant
excess of
like in
skin.
the future, you know, just like I'm getting a little older.
Well, yeah, he
I
said
think
there
I-
But
comes a
what I'm
time.
saying is you got to find a plastic surgeon who can look at you in the eyes and tell you, knowing what we know, if I'm all for it, it means I know that I can make you look better. There is a greater than 95% chance that I'm going to make you look better and you are not going to regret your decision. If it's less than 95% chance in my little thermostat in my head or barometer or whatever you want to call it, I'm not going to recommend a procedure to you, because not only are you a billboard for me, if you look a little fucked up afterwards and somebody says, "Who did your eyes?
Yeah.
Who did your lip lift?" "Oh, no,
Yeah.
you're talking to my lip lift." It's like I'm
Bad
accountable
press.
for it.
Bad
So
press.
not only do I care about you, but there's also a selfishness to doing the right thing for people.
Yeah.
And so I'm going to put a plug in for young, hungry surgeons who have a lot to lose.
Mhm.
And so I do think that you've got to find somebody you mesh with, somebody who really understands what you're going into. And that's what I would say for people going into plastic surgery. Yes, if you're getting facial plastic surgery, don't go to somebody who specializes in BBLs.
Yes.
Mhm.
You
Don't
gotta
do it.
you
Well,
gotta be a
that's
pro you gotta
fucking
be a
common
product of your
sense.
yeah.
It's not, though.
That is common sense,
But it
I
ain't.
feel like. That
But
is
it's
wild.
common sense to you because you're a
I would
savvy New Yorker,
never.
Yeah.
you know? It's not common sense to everybody. And that's not because they're dumb. It's because social media is so impactful.
It's
Yeah.
so
No,
impactful.
it
That
is.
you assume somebody who's got 100 million followers, A, those are genuine followers, and B, you assume that means they're a good surgeon.
It's
Yep.
scary that surgeons who do BBLs would operate on somebody's face.
Yep.
That's the scary part to me. Like, if
We
they're
all
not an
trained in
expert
it.
in
Well,
that.
I mean, theoretically, if they're a board certified plastic surgeon, they're qualified to do facelifts. I'm
I
just
know, but
saying, if you're going to consider somebody to do something,
yeah.
make sure you see their work and that you talk to them and that you really get a good feeling that they have a true grasp of what you're trying to do.
Okay,
Yeah, I
so
think
your barometer for me is 95% and above.
Yes.
Okay.
Yes.
I feel
Okay.
like that goes for anything in life, right? Like when you seek something out, like you're gonna go to somebody or someone, at least common sense, the common sense in my little head, that's the best at it or
Mhm.
specializes in it, right? You're not gonna go seek somebody out that doesn't specialize in it or that does a broad range of things. I don't know. That's just common sense to me.
Yeah, but I mean,
It's
I
common
guess
sense too,
again,
but
most people are stupid. Like
what
they don't.
attracts a lot of people, including myself, to plastic surgery. So let's go back to that conversation. When I was doing ortho, it was all hips and knees, hip, knee, knee, hip, 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 and then plastic surgery was head to toe. The
Yeah.
beauty of plastic surgery and what attracts some artists and artisans to this field is the fact that we can improve the body head to toe, multiple types of tissue. So I'm not saying you need to go to somebody who only does facelifts.
Mhm.
You got to get your eyes done by somebody who only does eyelids. No, you got to do something. You've got to find somebody who does a lot of what you want and has befores and afters to
Yep.
show for
Yeah.
it and
Yep.
has savvy.
Yep.
Well, and if it was me, I would be going to somebody who is an expert in that. Like if I want something done in my face, I'm going to the face guy. If I want something done in my
But you
body,
can get
I'm
your
going to
eyes
the
done
body
by a
guy.
board certified plastic surgeon who does
That's
facelifts.
that's the way I vet.
Don't overcomplicate it either.
That's the way I would bet too,
Because
right?
it's like if you're doing this, if you're doing boobs all day long, like I'd rather you be doing my boobs than somebody who does face 4 days a week and boobs 1 day.
Without dropping names, I can tell you 10 plastic surgeons who are amazing at facelifts and breast augmentations and breast lifts and breast reductions.
I'm just telling
And
you what I would do
rhinoplasties.
if it was me.
Okay. All right. All I'm saying is that's the right spirit.
Yeah.
That's the right spirit. But to
I get it
drive
because you're
plastic
trained
surgery.
in it
I
all.
love doing facial enhancement. The face
Mhm.
isn't just the lower jowls and the neck. The face is the eyes, the nose, the lip lift.
Yeah.
You don't have to go to Beverly Hills because this guy's known for the Cupid bow lift or this or that. You know,
Mhm. I
you
know what
can
you're
get it.
talking
You
about.
can. No, you don't.
Yeah, I do.
No, you don't. Can we delete that,
Fucking A,
please?
dude.
My
Yeah,
ponytail
I'm
lift.
not. You can find somebody who specializes in a certain body area
Yeah.
and really knows how to harmonize certain things.
Yeah.
Okay.
Got it.
Where do you see, I guess to kind of leave off here, where do you see this going, the evolution of your profession in the next 5, 10, 15, 20 years because of technology, because of AI?
I think AI is going to drive a lot of decision making for both consumers and plastic surgeons. It's going to help. It's going to help design facial implants. I think long gone will be the day of the off the shelf facial implant. It's all going to be custom in the next 20 years.
Do you see robots having an impact in this?
Nah, robots don't scare me.
Yeah, but I'm not talking about Terminator type robots, but like, you know what I mean? Like surgeon
No,
robots, no?
no. I think people are trying to get into it. You hear about robotic
That would
surgery,
scare
this and
me.
that. I mean, it's great for like certain things and like taking your appendix out or something like
Yeah.
that, you know, and you want to minimize incisions and do as much from a remote. It's still
You'll
not
be
a robot doing
retired
the
by that
surgery,
time
but
anyways.
it's still not. It's still surgeon doing it. It's just sort of doing it through a machine.
Yeah.
But there's still a surgeon whose hands are doing the surgery. I don't think that there's a role that I can foresee of robots taking over surgeons.
I was thinking about that actually driving here. I wanted to ask you that. And I feel like robots, obviously, they're going to be a thing one day, whether we like it or not. Maybe not for surgery. And I think because surgery, especially as somebody who's really good at like what you guys do, it's an art. It's like an artist, like with a painting, or somebody who's just like good at art, right? And a robot doesn't have human emotion, right? A robot may be one day smarter, faster, cheaper than any human, like resources that we're going to put into a human being, but they don't have the art form, the artiste part of it. And I feel like that's something that, I mean, your guys' profession is going to kind of stand the test of time, even as it evolves, right?
Yeah, it's a good question. I think AI is going to be a meaningful player before robotics are in my specialty. Robots, in terms of point of care manufacture of facial implants and guides for surgery, maybe, but as far as being there to convey certain feelings to a patient, certain experience, certain emotions, and to really be able to look at somebody and not predict how they want something, but rather to ask them what they want and to mix that with your experience in terms of what surgery can achieve is something that I don't foresee artificial intelligence even scratching the surface of in the next several decades, or if not our lifetime.
Yeah, I agree with that. Just like what you guys do is so cool, right?
Yeah.
Because of you guys are artists, right? It's like every face is another blank canvas. Every pair of boobs is another blank canvas, etc.
What AI is going to do is it's going to suggest certain things to people, and it's going to drive sales for plastic surgeons because people are going to become aware of things that they weren't aware of.
It's going to make decision making easier.
Yeah.
For both doctors and patients.
Correct.
But it's also going to probably lead to higher complication rates and disappointment and things like that.
Yeah. Bad decision making.
And possibly bad decision making.
Yeah.
Oh, can I have one of these?
We'll just hear your voice and
Sprinkle
not show
salted
your
caramel. Tell me more about this.
I mean, they're pretty amazing.
They're pretty damn good.
I'll be the judge of that.
Yeah.
Okay.
Walmart nationwide. Okay, well, you're amazing. This has been great. I am obsessed with everything that you have to say. And I'm excited about the CO2. I'm really going to do that. So thank you for being here. We appreciate you. Thanks for sculpting my face with my buccal and chin lipo. It's been a game changer. It really has.
This is a game changer for me. Sprinkles. Salted caramel mini chocolates. Thank you, Sprinkles. You can find this online.
How can people find you?
www.sprinkles.com.
On social media.
Jonathan Zelken, MD.
Jonathan Zelken.
Spelled Zelken is my YouTube handle, my Instagram handle. I don't know if it's my TikTok handle because I've never opened my account, but I think it is. And www.zelkenmd.com for those who still use the interweb.
Yep.
And where's your office located?
My office is located 1617 Westcliff Drive, Newport Beach, Newport Beach, California.
Look like fucking Google Maps.
17th Street.
Take a left. I love when people say go north on where the fuck is north?
You're in Newport Beach.
Newport Beach, California.
That is a skill that I've always wanted. When you know how old timers sometimes say go west on, is that towards Vaughn's or towards Michael's?
It's easy in California.
West, east,
No,
Or
north, south.
Vermont.
It's not easy for me.
It's
It's
hard in
not-
Florida.
It's not easy for me.
easy for me.
Okay, no,
All
you're
right.
the best though. We appreciate it.
Thank you
I
for
I
coming
want to
on.
give
This is
you
awesome.
a package to take to your office.
Okay. I'm not going to
Oh,
argue
sure.
that.